Hi, myself Dr. Saurav Rana. I am from Medical College, Kolkata. I would like to start one of the most important topic in medicine, that is rheumatology. But first, I would like to show that what connective tissue disorders we are going to discuss, and those are number one, SLE, systemic lupus erythematosus, the most important disease. Number two, APLA syndrome, antiphospholipid antibody syndrome, Sjogren syndrome, polymyositis, dermatomyositis, mixed connective tissue disorder, and sarcoidosis. But here is another important entity that you should know: rheumatoid arthritis is a mixed entity. You can keep it under the heading of connective tissue disorder. Okay. Now coming to our first and important topic, SLE. Okay. So it is a disease of females in reproductive age group. Reproductive age group females are most susceptible. All of you know, I think, male is female ratio is very strict in this disease. It is 1:9, or rather say female is to male is 9:1. So females are more susceptible, but in reproductive age group. Male can have SLE, but the prognosis is very poor, and it can come as a question in your MCQ. There is a separate entity, childhood SLE, and you just know one thing: there will be 100% renal involvement. All I am saying in these slides are only exam oriented and to the topic. Okay, so just remember the facts. These are facts, nothing else, and these can come as MCQ. Okay, childhood SLE, there will be 100% renal involvement. I always try to keep the subject simple and to the point. Okay. It is a type 3 hypersensitivity reaction. SLE is a type 3 hypersensitivity reaction. So what do you know about this? Yes, there will be deposition of immune complex mediated disease. So there will be deposition of immune complexes. Like where? Number one, vein vessel wall, and it will cause vasculitis. Very simple. Number two, joints, and it will cause arthritis. Yes. And number three, glomeruli. So it will cause glomerulonephritis. So these are the entities which will fall under the categories of SLE, because it is a type 3 hypersensitivity reaction. That means immune complex will get deposited in organs, like in vessel wall causing vasculitis, in joints causing arthritis, in glomeruli causing glomerulonephritis. Okay, so that's that. So now what are the risk factors? The first and foremost is the genetic susceptibility. Genetic susceptibility is the most important risk factors to cause SLE. Then comes environmental factors, which I will discuss later. Environmental factors. Okay. So in genetic susceptibility, what are the points? Number one, most strongest genetic risk of SLE is, what is the deficiency? Early complement deficiency, that is C1q, C2 and C4. And among these, C1q is the most important. C1q is the most important. Early complement deficiency is the most and strongest genetic risk factor for SLE. Now I will give another fact, that late complement deficiency, you have to know that C5b to C9, the person can be susceptible to Neisseria or Toxoplasma infection. You just remember that, because it can come as a question. Okay, so the most strongest genetic susceptibility is early complement deficiency, C1q, C2 and C4, and among them C1q is the most important. Okay. Number two, HLA DR3, DR2 and D8. Among these, HLA DR3 is the most important. Okay, you have to remember this. SLE is a versatile topic and it can come in question involving any body systems, any body systems, now neurology, rheumatology, pulmonology, anything they can give questions. Okay. Number 3, why the females are more susceptible? Yes, I can show you the answer, and that is TREX gene mutation. TREX gene mutation. It causes the female to be more susceptible, and TREX gene presents on which chromosome? And that is presents on. It can come as a question. Presents on X chromosome. Very good. It presents on X chromosome. Okay. So, like I have said it earlier, that not only genetic susceptibility can cause SLE, but it will also need environmental risk factors. Okay. So, genetic factors plus environmental risk factors will cause SLE. You can think that some persons who not belong to any genetic susceptibility, they are only involved in environmental risk factors, but they cannot develop SLE. You have to develop SLE only if you have those genetic susceptibilities. Okay, not only environmental risk factors cannot play. Okay, it can flare up the reaction. Okay, so now come to the environmental risk factors. The most important is Epstein-Barr virus infection, EBV infection. Okay. Number 2, OCP and HRT. Okay. Number 3, smoking, very important. Number 4, deficiency of vitamin D. Number 5, silicosis. See, all of these can present as a MCQ choice, and you have to find which one is the best, because I can say one thing, that OCP, you see during clinics or any OPD, that many reproductive age group female can come to you and say that yes, I am taking OCP for such a period of years, 3 years, 5 years, 10 years. So do you think that all of them can develop SLE? No, because they have to have that genetic susceptibility I told you earlier. Genetic susceptibility with the environmental risk factors can only cause SLE. Not only the OCP taking will not cause the SLE. Okay, HRT means hormone replacement therapy. So just see that genetic plus environmental risk factors will cause immune dysregulation. Immune dysregulation. And immune dysregulation means innate immune system is activated. Okay, and I can clearly say that immunity system is activated. It means increase apoptosis with decrease clearance of apoptotic cell. Okay. Now I can show you another thing. Just see. UVB rays do not trigger SLE, rather it can cause flare-up of the disease. Yes, it has come as a question in NEET-PG, so I have just told you UVB rays do not trigger SLE, but it can cause flare because it is an environmental factor, and without that genetic susceptibility, it cannot cause SLE, but it can flare the disease. Okay. Now, what is innate immune system activation? Okay, so already I am coming to the etiopathogenesis. I have told the etiology, now I am coming to the pathogenesis. Okay, so the most important cytokine factor involved in SLE would be interferon alpha. Interferon alpha, this is the MCQ question. Interferon alpha, you have to remember that. Okay, produced by lymphoid dendritic cell. Genetic signature of SLE, upregulation of genes due to interferon alpha. Obviously, you don't have to remember that upregulation of genes. You just remember the key pathogenic cytokine is interferon alpha. Interferon alpha does what? It upregulates myeloid dendritic cells and activates them to present antigen to T cells and T cells get activated. So interferon alpha will get secreted, it traps antigen and then present it to T cells so that T cells get activated. And then what happens? See, T cells we divide into Th1, Th2, T helper cells and Th17. Among them, Th2 is the most important. Okay, Th2 is the most important. It secretes interleukin 4, 5, 10 and 3. Or you have to remember this. Interleukin 4, 5, 10 and 3. What will this cause? It activates B cells. B cells will produce antibodies and antibodies doing what? Immature complex deposition in organs. Yes, antibodies will attack our own organs by creating immature immune complex deposition. Okay. In first or second slide, I have said if the deposition gets in vascular wall, it will cause vasculitis. If it gets in glomeruli, it will cause glomerulonephritis, and if it gets in joint, it will cause arthritis. Simple, very simple. Okay, I think I have tried it very simple. Now go to next slide, and that is how B cell is activated by T cell. T cell activates B cell. Just remember this in medicine. It will get time to learn in descriptive way in pathology. Okay, I have just sorted out the 3 points. Interleukin 4 pathway. Number 2, CD40 ligand and CD40 interaction. Remember, CD40 ligand present in T cell and CD40 present in B cell. This can come as a question. I have just said it here as the fact. You have to learn in pathology because I have not that much of time. Okay, I have to teach you medicine. And number 3, interleukin 12-21 pathway. Just remember this. Interleukin 4 pathway, CD40 ligand, CD40 interaction. CD40 ligand is present in T cell, CD40 in B cell, and number 3, interleukin 12-21 pathway.